Hi everybody. Here is some information on Chapter 21 in your textbook. Chapter 21 deals with neurological conditions. Now, some of these we might have a little more difficulty working with these particular clients, but there are some basic things that we can keep in mind. Now, obviously, if you're going to be working with a special population, I would expect that you're going to research it so you know exactly what you're getting yourself into using more than just your NSCA textbook, but go out there, find some reputable sources and find some more information out about these conditions and as a personal trainer, how you can work with that particular clientele. Okay, so definitely it's going to require some work if you're taking on a special population to train. So looking at this chapter, the three areas that it does talk about are the spinal cord injury clients. We have those who have MS, multiple sclerosis, and then cerebral palsy. So some similarities across the board that we see in these three conditions are number one, spasticity, meaning they might have uncontrolled muscular contractions, they're spastic, and sometimes they're very noticeable, they're huge, and then sometimes they're just minute, very small, but it's just a spastic problem where their muscles are constantly under this contraction. They also tend to have impaired coordination. They might be more apt to fall. They might be uncoordinated and have a higher fall risk. And then also we tend to see an increased sedentary lifestyle when people are diagnosed with these conditions. And therefore, they're going to have a higher risk of cardiovascular disease due to that sedentary lifestyle that they're suffering. Also, they're going to be on medicine, okay? They're going to be taking in a lot of drugs to help them cope and get through having this disease. So we have to note that and make sure that we're understanding, does it have an impact on the heart rate, but also do they have side effects? So some of the medications that these groups are taking cause dizziness. As a side effects, they might make them sick, they might be nauseous, and then it might make them very tired. So that might interfere with when do we train our clients. So we might find out, when did you take your medicine, or every day, what are the times that you take your medicine? And if it causes that nausea within 1 to 2 hours post, taking that medicine, maybe we should train our clients later on in the day if they take their medicine first thing in the morning, or vice versa, if they take it in the evening, train earlier in the day to avoid those side effects that come along with taking that particular medicine. So as far as pathophysiology of the diseases or these disorders would be, for this SCI spinal cord injury, they have just an overactivity of the autonomic nervous system, an overactivity, so which in turn can cause extreme sympathetic responses like a rapid increase in blood pressure. All right, so these people who suffer spinal cord injuries tend to just generally, as a result of that injury, always have a higher blood pressure. Also, headaches are more common in these people. Profuse sweating, so thermoregulation is a big issue, and sometimes even blurred vision occurs. For those folks who have MS, again, it's an involuntary, sustained, and sometimes even very painful muscle contraction. So this can be very, very painful for these people as the disease progresses. And then CP, cerebral palsy, again, is an exaggerated muscle contraction, but a lot of times they're very, very tight. So flexibility is something that this group really needs to work on. So when we again look at our exercise recommendations across the board for these three groups, it's pretty similar. So again, we're looking at the similarities. So as far as aerobic exercise, doing at least 3 days a week is recommended. Always start with low intensity and start with shorter duration, just like I said with the last group of the cardiovascular disease. 10 minutes to maybe 20 minutes is about all that they could probably handle. When we do resistance training, at least 2 days a week is recommended. Start with 1, maybe 2 sets per exercise, and then low repetition ranges, anywhere from 8 to 15 reps. And start again, body weight, and if we can, progress from there. So some concerns when we look at exercise with these special populations, number one is thermal regulation. You know, they tend to overheat. So making sure that we're in a well ventilated room, making sure there's multiple fans available to be blowing on them while they're exercising, trying not to exercise in really hot, humid environments, you know, because of that issue with thermal regulation. And then fatigue and impaired coordination. These folks definitely have some issues with that, with these diseases. So making sure, for example, if we're doing weight training, doing it in a stable environment, like in a machine-based setting versus doing maybe dumbbell exercises, because in a machine it's more stable, right? And they're less likely to fall. So make sure we're being cautious with, you know, I know we want to do stability exercises and do balance challenges, but with this group, that's something we want to be very cautious about doing. And they're going to get tired easy. So it's going to be shorter bouts, give them longer rest periods. They'll progress at a slower rate, but at about 50% slower than healthy clients. So please note, there will be a progression, but it's going to take them a little bit longer to get where you want them to be versus if you had a healthy client, you would have been there already. So we have to keep in mind the progressions will happen if we work at it, but it's going to be at a slower rate. Also, there's physician prescribed contraindications. So the doctor is probably going to say, hey, I don't want, you know, this patient doing X, Y, and Z. So we have to abide by that and make sure that we're following those prescribed contraindications that their doctor is telling us. And then the severity of the symptoms dictates the exercise prescription. You know, certain days they might feel horrible, you know, based on, you know, the symptoms that they're, you know, going through that particular day. Sometimes they have good days, sometimes they have bad days. So we have to be able to think on the fly and just try to, you know, change, you know, as needed when it comes to those symptoms that they're experiencing. Other concerns as far as spinal cord injury, decreased venous return may cause blood pooling. So people who have spinal cord injury, you know, they're probably going to be in a wheelchair. So we have to think about what can we do in a wheelchair position. So maybe if we can get them in and out of the wheelchair, if they're good at doing that, they could do more supine exercises laying on their back, but monitor their blood pressure while we're doing that. So versus staying seated, you know, in the wheelchair doing those exercises, we could have them lay down if they can get out of the wheelchair and do supine stuff to help maybe work with that venous return. Also, they tend to have an increased overuse injury in the wrists, the elbows, and the shoulders because they're constantly, how do they get around? They're pushing their wheelchair using their arms. So therefore, you know, they have overuse. Their wrists start to hurt, their elbows start to hurt, their shoulders start to hurt. So try to incorporate more posterior shoulder exercises to pull that posture back, right? So they're not constantly leaning forward. So working on the rhomboids, the rear delts, the trapezius, posterior shoulder girdle exercises are great. All right, and then the possible altered autonomic control of heart rate. Again, they tend to don't have the normal heart rate response as folks who don't have SCI. So use RPE instead of heart rate to monitor their intensity. So you can still do cardio with folks who are in a wheelchair. Arm ergometers are a great way to get their heart rate up. So they can sit in front of it, wheel their wheelchair right up to it, and crank the arm ergometer, and that's going to get their heart rate up. So that's a great way that these folks can do cardio and still work on aerobic fitness. For epilepsy, just some concerns. Number one, these folks might have a fear of exercise. Maybe they had a bad experience because maybe they the exercise they did in the past induced a seizure. So therefore, they're scared to exercise. So note that vigorous exercise can induce seizures, sometimes in about 10% of the patients. So try to stay away from vigorous exercise, very low to maybe moderate intensity. As far as seizures go, if a patient does or a client does experience a seizure, what can we do as far as first aid treatments? Have them or position them in a prone or sideline position. Okay, so we want them to be laying down, maybe on their side, okay? Or they could be laying in a prone position. Don't restrain them, okay? We don't want to hold them down. Don't put anything in their mouth, okay? Observe them until they regain consciousness. So basically, there's not anything for the most part we can do. We just need to remove items around them that they could hurt themselves on if they're having a seizure. We're not going to restrain them. We're not going to put anything in their mouth, and we're just going to stay with them until they regain consciousness. So basic, first aid if somebody happens to have a seizure when we are around. So those are just a few things that go along with chapter 21, and that is it.